Good morning. My name is Tracy Terlindi, a health educator, and today we're going to be talking about maternal mortality in African American women. Maternal mortality is increasing at a higher rate in African American women more than any other race. Maternal mortality can be described as a woman dying within 42 days after giving birth. African American women are 3 times more likely to die from pregnancy and/or childbirth complications than white women. They have a higher risk of developing cardiovascular disease, hypertension, and preeclampsia. Georgia and Mississippi have higher rates due to larger African American population and more rural communities. So why is that? One is social determinants of health, which is education, community, employment, access to health care, access to fresh and nutritious foods, and they also see more discrimination in health care. In the U.S., 17.2 women die per 100,000 births from maternal mortality. African American women have a rate of 40 deaths per 100,000 births in the United States. So this is a huge difference between the national average and African American women. This is a major public health concern. They are exposed to more stressors and experience different things that the white population does not. So let's take a look at it from the socio-ecological model. When we look at the individual level, things that can help reduce maternal mortality rate is living a healthy lifestyle to decrease that chronic disease risk of developing chronic diseases. And this can influence positive pregnancy and postpartum outcomes. Things that hinder positive pregnancy or postpartum outcomes is race, as African American women are more likely to have complications during pregnancy and postpartum. So when we look at the community level, community assets such as public transportation, federally qualified health clinics, parks, grocery stores, schools, these can all provide proper access to healthcare, healthy foods, education, safe areas, and promote positive health outcomes and reduce stress. Health disparities such as racial discrimination increases the risk of maternal mortality. At the policy level, Healthy People 2020 has a goal to decrease the maternal mortality rate. Things that increase the risk of maternal mortality at this level is lack of postpartum healthcare checkups. Many insurance companies, as well as Medicaid, only pay for 1 visit after birth, or up to 2 if a woman had a cesarean section. Increasing the amount of times that they can go see the doctor, especially if they're at high risk and have chronic diseases, can decrease that maternal mortality rate. So what can we do to help reduce this rate? So there are interventions that we can impose to help reduce that rate. Providing more school-based health clinics with reproductive health services. So providing teens with access to reproductive health care, contraceptives, and providing them that reproductive health knowledge in the school can decrease the risk of teen pregnancy and STIs, which then promotes positive health outcomes. Mobile reproductive health clinics can provide reproductive health care and chronic disease management by going into those low-income areas where more individuals have transportation issues, in the rural communities where there aren't any health clinics and there's no transportation. So this can provide early access to pregnancy health care. It can also provide chronic disease management and reduce those stressors and increase health outcomes. Grady Memorial Interpregnancy Care Program follows African American women up to 2 years after having a poor pregnancy outcome. This increases their knowledge of reproductive health care, decreases the risk of short interpregnancy intervals, and also provides chronic disease management. So when we look at these interventions and how we're going to evaluate the successes, we're going to see adolescents are using contraceptives. We're going to see that decrease in teen pregnancy after this program has been established. We're going to see increased access to prenatal care. We're going to see reduced poor pregnancy outcomes, better chronic disease management, and reduced short interpregnancy intervals. And how we're going to see that? We're going to collect the data on pregnancies before and after initiation of programs. We're going to survey the participants in each group and find out what's working and what's not. We're going to count how many people are utilizing the services and the programs. And we're also going to be collecting data on their lab and blood work, on their chronic disease management. Is the hypertension better? Has their blood pressure gone down? Are they managing diabetes? These are all things that we're going to measure to look at the successes of these programs. Barriers that we need to consider are limited participation and possible dropping out of the program. The solutions are to stay collaborated with our community partners and other agencies for advertising and referrals to these programs. We want to get these women who are at risk in these programs to increase their health outcomes, positive health outcomes. We're going to provide incentives for these participants so they keep coming back. Looking at the logic model, so we can see that the inputs we need are the community partners, the stakeholders, pharmacy, laboratories, healthcare centers, healthcare providers, the health department, schools, mental health care facilities, funding, equipment to implement these interventions, trained professionals, support staff, the contraceptives. So these are all going to go into these interventions that we are proposing, which is then going to increase positive health outcomes by reducing those teen pregnancy rates, decreasing the STI rates, providing education on reproductive health, increasing access to prenatal care, increasing access for better chronic disease management, increasing healthcare access to those living in rural communities and low-income communities, decreasing short interpregnancy intervals, decreasing low birth weight preterm deliveries. And then that in turn is going to overall reduce the rate of maternal mortality in African American women. So I thank you for listening to me today and for my proposal. Thank you.